Assalamu alaikum and greetings to everyone. My name is Muhammad Sahil Ali and my ID is 2000165 and my course is Information System. Today our group, which is Group 1, will be presenting you an assignment on Obsessive compulsive disorder, which is also known as OCD. Before we begin with our presentation, I would like to introduce you to my other group members. In our group, we have Vijaya Darshini, Enoch Autumn, Nathaniel Chol, Asim Amin, and lastly Muhammad Faiz. In our presentation, we will be covering the introduction, problem and the problem statement, data and statistics, theory, prevention, intervention, and at the end, the conclusion. Now, I will be presenting you the introduction of our assignment. Mental health is a broad topic which is often not talked about in our society, and people who are suffering from mental illness are dismissed and at times ridiculed. This is mainly due to people's ignorance and lack of understanding of this topic. So before we go further, we need to understand what is mental health. Well, according to Feldman, mental health refers to cognitive, behavioral, and emotional well-being. It is also about how people think, feel, and behave. According to WHO, which is World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make contribution to his or her own society. The topic we selected is Obsessive compulsive disorder, or OCD. So what is OCD? Well, OCD is a mental illness in which the person suffering from OCD tends to have unwanted thoughts which urge him to do simple tasks repeatedly. The person suffering from OCD spend most of their time and efforts on simple tasks which are rather easy for others. So why did we select this topic? Well, it is a very common illness these days and people should be educated on this. Through this presentation, we also want to raise awareness on mental illness and mental health. We want people to realize that just like any other illness, mental illness is real and needs to be treated. People suffering from mental illness should be helped and taken care of.
Hello, ladies and gentlemen. My name is Nathaniel Chol. I'm an IT student. My ID is 2-0144. Well, in this presentation, I'm basically going to highlight the definition of OCD and the problem related to OCD. Well, talking about OCD, it can be defined as a mental illness in which individuals do have recurrent thoughts that are unwanted. It could also be ideas or feelings that cause them to feel compelled to do something several times. Examples of OCD include like the fear of being contaminated by the people around them or the environment, or it could also be the fear of blotting out insults. While talking about the problem related to OCD, people with OCD have relentless thoughts and strict behaviors. They do also have trouble disconnecting from obsessive thoughts or stopping compulsive behaviors, though they are aware that their obsessions are unrealistic. In addition, most individuals who do have OCD are aware that their obsessions are not real, meaning that they are unrealistic, while others believe they are real. Well, OCD is typified by intrusive thoughts or images that heighten anxiety and repetitive or ritualistic acts that reduce anxiety. Well, that about wraps up the definition and the problem statement related to OCD. Thank you for listening, and I'll pass it to the next speaker.
Hello everyone, my name is Enoch Autumn Severino, a member of Group 1. I'll be presenting to you the part of our report which talks about data or statistics. How common is OCD? As we already know, OCD is a mystery. OCD has a relationship with hereditary conditions, but then the causes are pretty much unknown. Now, this chart below shows us the statistics of OCD by severity from the year 2001 to 2003. 50% of people who have OCD get significant disability, 35% of people who have OCD get moderate disability, and only 15% of people who have OCD have minor disability. Moving on, we are looking on the statistics of OCD by demographic factors and by age group. As we already know, OCD has a genetic part. That means it is difficult for us to draw any conclusion between age, race, socioeconomic status, or anything like that for it to start. However, OCD and aging may be connected. Most people who have OCD show the symptoms of OCD by age 14. That is to say 25% of people. If you are past age 14 and you have not shown any signs and symptoms of OCD, that means you are 25% less likely to develop OCD. As we can see, OCD sufferers have a higher risk of suicide than other non-OCD sufferers. If we look at OCD and other co-occurring mental health conditions, we can see that 90% of people who have OCD have at least one other mental health disease. In another research, it showed that the global occurrence of OCD is 1%. Members, we have reached to the end of my part 4 presentation. Thank you very much, and we continue with the next part.
Assalamu alaikum and welcome to our presentation. My name is Muhammad Faiz Khan, and today I'll be telling you the theories behind the occurrence of OCD. Since the topic of mental health is very recent, there are multiple theories as to why OCD occurs. The first of which is compulsions are learned behaviors which become repetitive and habitual when they are associated with relief from anxiety, such as nail biting as shown here. One other reason is that OCD is due to genetic and hereditary factors. According to certain researchers, the occurrence of OCD is among first relatives is 7 to 15%. Chemical, structural, and functional abnormalities in the brain may be the cause. Chemical imbalance in the brain such as dopamine, glutamate are most visibly in OCD patients. Even environment can play a role. Even someone who has extraordinarily strong behavior tendencies to develop OCD may never do so if the right environmental conditions are not triggered. We have also come to find that personality plays a cause. People who are reward dependent, impulsive, overly cautious, or perfectionists are higher chances to develop OCD.
Therapy helps you understand that the brain is sending error messages. Your therapist will help you learn to recognize these messages and respond to them in new ways to help you control your obsession and compulsion. Cognitive therapy focuses on the meanings we attach to certain experiences that we misinterpret. Cognitive therapy helps you stand back from these thoughts, look at this evidence closely, and tell yourself something more realistic or accurate. Cognitive therapy for OCD focuses on the experience of negative thoughts. Research shows that believing that negative thoughts are important and attempting not to have bad thoughts actually produces the opposite effect. Therapy, people who have OCD are placed in situations where they are gradually exposed to their obsessions and asked not to perform the compulsion that usually ease their anxiety and distress. This is done to your pace. Your therapist should never force you to do anything that you should not want to do. The first step is for you to describe all of your obsessions and compulsion. Then you and the therapist will arrange them in a list, ordering them from things that don't bother you much to the things that most frightening. Next, the therapist will ask you to face your fear of something on your list, starting with the easiest. The new way of confronting your fears directly will lead to fewer and less intense fear or obsession. Your brain learns that nothing bad happens when you stop performing compulsive ritual. When a therapist helps you with exposure over a period of time, your anxiety shrinks until it's barely noticeable or even fades entirely. The therapist can help you gain confidence and learn special skills to control. Cognitive therapy helps you understand that the brain is sending error messages.
My name is Asam with student ID 19000918. Today I'll be talking about intervention and conclusion. So starting with intervention. A few years ago, people lost their hope of recovering from OCD as it was considered untreatable. However, with today's technology and research, it is obtained that there are two therapeutic treatments. If they are applied correctly, they might be able to minimize or even eliminate obsession, which leads to change how OCD is understood. The two treatments are pharmacotherapy and psychotherapy. So let's start with the first one, pharmacotherapy. Pharmacotherapy can treat disorder and diseases with medication as in the treatment of addiction. However, medication is used to reduce the intensity of withdrawal symptoms. The second one is psychotherapy. Cognitive behavioral therapy, CBT, is known as the most usual form of psychotherapy. CBT has two main forms for treating OCD, which are known as therapy and response prevention (ARP), and the other form is cognitive therapy (CT). ARP involves direct or imaging controlled exposure to objects which lead to trigger obsession that cause anxiety. However, unlike ARP, CT aims to focus on thoughts that handle obsession. Moving on to the second part, conclusion. Obsessive compulsive disorder (OCD) is a mental illness in which persons have recurrent unwanted thoughts, ideas, or feelings that cause them to feel compelled to do something over and over. OCD statistics by severity showed that in the years 2003 and 2001-2003, more than half of people with OCD, about 51%, had significant disability, and between 2001 and 2003, about 34.8% of adults with OCD showed moderate disability. Also, in the years 2001 and 2003, about 15% of those with OCD experienced minor symptoms of disorder. And for treating OCD, there are two effective treatments to be used, which are known as pharmacotherapy and psychotherapy. And the most common form of psychotherapy is known as cognitive behavioral therapy (CBT), as stated by International OCD Foundation. Do you have any question for us? And thank you so much.